Would you like for the Greater Hickory Metro to learn more about you and your business? You can do that with the First Talk Business Brief, a 4-minute extended advertisement for your business any Monday through Thursday morning on First Talk with Hal Rowe. The First Talk Business Brief is a paid commercial advertisement and is available to advertisers of 1290 WHKY. Contact your account representative for more information. We hope you enjoy this First Talk Business Brief.
Good morning. Welcome back to First Talk with Hal Rowe on 1290 WHKY Talk Radio for the Greater Hickory Metro. Joining us this morning, Sara Paul, nurse practitioner with Hickory Cardiology, Western Piedmont Heart Centers. We're going to be talking a little bit this morning about Day of Dance. It's coming up this Saturday the 18th, of course, brought to us by Frye Regional Medical Center. It's going to take place at the Hickory YMCA. 9 o'clock to 11 o'clock, you do need to get registered. Call 877-31-WOMEN. And now they're going to be doing some testing out there as well. And if you're going to be doing particular testing, then what you're going to need to do is some of that's going to take fasting blood work. So you're going to need to make sure that if you're going to come out and get involved with this, then you need to make sure that I think it's like nothing after midnight and only fluid in the morning and maybe they're nodding their head. Everybody's saying, yeah, you pretty much got that. I think you can actually have a sip of coffee, but probably not a real good idea. And don't brush your teeth. I found that to be interesting as well, because sometimes the sugar in the toothpaste, well, actually, if there's a sweetener in the toothpaste, will kind of get things messed up a little bit. But that's just my personal. They're not saying that. That's just me. But fasting blood work, you need to make sure that you do that. Joining us this morning, Sara Paul. Thanks so much for joining us this morning. Good to see you.
Thanks for having me, Hal.
Now, first of all, help me with nurse practitioner. What does a nurse practitioner do? What does that the title involve?
Well, a nurse practitioner is a registered nurse who has an advanced degree. Okay. In my case, I have a doctoral degree.
Really?
But most nurse practitioners may have a master's degree. And we are able to prescribe and diagnose in patients, but we also bring to the table the nursing aspect, and we look at the patient as a whole. So we look at the spiritual side, we look at the patient education, we want to teach patients, as well as treating their disease.
Wow. Now, are you from the area? Where did you do your undergraduate, graduate, and doctorate?
Undergraduate, Florida State University.
Okay.
Master's degree, University of Alabama, Birmingham.
Okay.
Nurse practitioner, Medical University of South Carolina in Charleston, and my doctoral degrees from Duke.
Wow. Well, that's really fantastic. Curriculum vitae, is that the way that you all say it? Resume there.
A lot of schooling.
A lot of schooling. Well, that's fantastic. But I think it's interesting that you bring in the spiritual aspect, that you brought that up as well, kind of a holistic view.
Mm-hmm. I work with patients who have congestive heart failure at Hickory Cardiology. Right. And quite often that's a terminal disease. Okay. And so I work with patients in the end of life as well, from the full continuum, from diagnosis to end of life. So we work with palliative care and hospice as well. So the whole continuum.
I hear is congestive heart disease, is that what it's called?
Congestive heart failure.
Congestive
heart failure.
Heart failure. What is that? Help me with that definition.
Well, it's basically when the heart does not function appropriately.
Okay.
Usually it's enlarged. It may be weak or it may be too stiff to really function appropriately.
Really? I guess there's all kinds of causes for that, but we'll talk about that, or hear maybe some about that with your presentation on Day of Dance. Again, Saturday the 18th, Hickory YMCA. Call 877-31-WOMEN to register. You're going to be presenting there. Tell us what we're going to be talking, what we're going to hear about, and what you'll be sharing with the folks in attendance.
Well, my presentation is going to be aimed toward women, to help women to recognize the symptoms of heart disease and also to be able to modify the risk factors for heart disease, such as smoking, weight loss, eating right, getting exercise. And I think that's what Day of Dance is a lot about, is getting some exercise and trying to get women to move.
And I think what a better way than dancing. When I heard about this, and they're going to have some dancing, you can get really a great workout. It doesn't matter what kind of dancing, but you can get a great workout dancing. So maybe that's a great way to start. People say, I don't want to work out, I don't want to, but so we've seen Zumba become very popular in the I guess South American, I don't know what country, but whatever it is, get people moving, get them dancing. So that's a great way to start. Help me with some of the things that maybe we're going to hear about specifically. Now, you talk about, from what I understand, and I don't know, you tell me, smoking is probably one of the things that we need to, or stopping smoking is one of the most important things that we need to do if we want a healthy heart. Would you agree with that? Is it weight loss or is it smoking or is it 50-50? What's your opinion on that?
I would say smoking, and also, that's completely in your control.
Right.
Smoking or not smoking is in one's control. For instance, you may be born with bad genes you inherited from your parents.
Sure.
You can't control that.
Right.
But there are things that you can control. And I think that's a lot of what my talk is about, is controlling the things that you can, such as weight, diet, smoking, exercise, that sort of thing.
So I guess there are smoking cessation classes because it is an addiction. It's so very difficult for many people to stop. It's just, so addictive. But that's one of the things that you would suggest that people really work on.
Absolutely.
Okay.
Yeah. There are new drugs available as well.
Oh, yeah, that's right. I've seen the commercials. They're always at the first of the year for those New Year's resolutions.
Right.
But you can keep smoking and then it will get you to quit eventually.
Right.
So quitting smoking. Now, how about weight loss? That has become, some people will say, well, in some case, it is an addiction. There are food addictions.
Mm-hmm.
In some case, people just like eating. Help me with what you would say to women who come to you, maybe in the office, Hickory Cardiology, Western Piedmont Heart Centers, or during the talk, they say, I just have a hard time taking off the weight. What do you tell women who are going through that and are having a difficult time with weight loss?
Well, of course, the older we get, the harder it is to lose weight. When you're young, you can lose a few pounds very quickly, but as we get older, it gets much harder. And much of that is because we become more sedentary.
Okay.
So if, I counsel my patients to be sure they move, even if it's just going for a 15-minute walk each day, becoming active. That is certainly part of it because that will burn calories. And the other piece is portion control. Watching what you eat and how much you eat is very important. But again, quite often our lives are busy. We eat fast food. We drive through Wendy's. We eat, not that, once in a while that's fine, but many of us end up eating that way 4 or 5 days a week, and those are a lot of calories.
It really does come down to a change of lifestyle, doesn't it? You
does.
Really have to rethink all of this. So we're talking about exercise, we're talking about quitting smoking, and we're talking about diet. And then those are some of the things that we can control. These are some of the things that we absolutely can control in our lives. As difficult as they may be, we can't change the genetics.
That's right.
If we get born with that, oh well. But these are some of the things that we can change.
Yes.
Again, it's Day of Dance. It happens this Saturday, the 18th, Hickory YMCA, presented by Frye Regional Medical Center. Call 877-31-WOMEN to get registered. They'll answer all your questions. A lot of great testing will be happening there. We'll have the presentation from Sara Paul, nurse practitioner from Hickory Cardiology, and a lot of great programs will be happening, as well as dance. There'll be dance exhibits, and I'm sure that there'll be invitations to come along and dance with those folks who are doing the exhibits as well. Let's talk about some of the symptoms or some of the signs for women that may be different from men, that women may say, because I've heard of these before. I've heard of some of them, and some of them are masked. They don't present as maybe a heart problem. Maybe they say, I've got a bad headache, or I've had. You tell me, what are some of the things that maybe women need to look out for, specifically for women, that might not normally indicate a heart problem, but are specific to women? Help us with that.
Well, let me lay the groundwork first and say that over a third of all deaths in women are from heart disease.
Really?
So it is the number one killer of women, and most women don't realize that. They think of cancer, breast cancer, because the American Cancer Society has done a great job of publicizing and making people aware of this.
Right.
But the American Heart Association has initiated the red dress. I'm sure you've heard of the red dress.
Absolutely.
And, so that's to bring awareness to women that heart disease actually is the number one killer of women. So women should be aware that they are at risk. Women think their estrogen protects them, but that's not always the case, especially as we age. And women tend to develop heart disease later in life than men, so that when they do develop it, they tend to be sicker than their male counterparts when they have heart disease, and they tend to die at a greater rate than their male counterparts when they have heart disease. And symptoms in women can often be shortness of breath, fatigue, and, well, what woman's not fatigued? People are busy, and so people just brush it off and think it's nothing. And often they don't seek medical help until it's quite late into the process because they don't have the classic chest pain, which is what we often think of. You see the man shoveling snow and clutching the chest, and that's what you think of for heart disease. But in fact, in women, they often have other symptoms. So women should really think about that, seeing their doctor if they're suffering other symptoms that may not be pure chest pain.
And find out more this Saturday, the 18th, the Hickory YMCA. Sara Paul, nurse practitioner from Hickory Cardiology, will be presenting. You don't want to miss this. Find out more about heart disease in women, how to prevent it, and how you may be able to prevent heart disease and a heart attack. Sara Paul, thank you very much for joining us this morning. Very nice meeting you.
Thank you, Hal.
More First Talk right after this.